Okay, so just to check, can everybody see the PowerPoint slide, the picture of the surgery? A thumbs up, good. I can see Lester and Michaela giving me a thumbs up, so that's fantastic. The introduction really is on the 1st of April. As many of you are aware, New Larchwood Surgery reduced its opening hours from 7 sessions, a mixture of mornings and afternoons, to 2 mornings a week. Patients were offered Carden surgery as an alternative when New Larchwood was not open. Patients did make their complaints quite vocal, and the fact that they were informed late, some after the change had already occurred. Carden surgery being further away, 25 minutes by public transport. And also there were general complaints about the lack of a local surgery. The clinical commissioning group, who commissioned primary care services, such as GP surgeries across Brighton and Hove, invited Healthwatch to get involved. We met with the Residents Association and the clinical commissioning group and surgery partners. And hearing the context, we proposed that a patient survey should be carried out to gauge opinions of the change. Paper and online copies were made available through the Residents Association. They were hand delivered to every resident in Coldine. They were made available at both surgeries and in the accommodation above New Larchwood Surgery, as well as at the local chemist. And thanks go to the surgery and to the Residents Association for helping ensure the distribution reached as many patients as possible. The survey ran over the summer for 2 months. New Larchwood Surgery has 2,143 registered patients at the time of the survey, of which 385 patients responded to the survey, providing a response rate of 18%. And it is important to note that this response rate is considered statistically significant, i.e., those patients who responded to the survey are likely to represent the opinions of those who did not respond to the survey. New Larchwood patients were being offered or are being offered a surgery, Carden, that is likely to already be in high demand. Carden is situated in an area of higher deprivation than New Larchwood, and we know that there is a strong link between deprivation and greater health need. Most patients who responded to the survey were female and described themselves as white and heterosexual. Also, 44% of patients were limited by disability, describing themselves as being limited in day-to-day activities. 18% of patients were informal carers, and that is to say that an unpaid carer is someone who provides unpaid help to a friend or family needing support, perhaps due to illness, older age, disability, a mental health condition or an addiction, as long as they're not employed to do so. It's worth noting that patients with disability and patients that had carer responsibility were more likely to be negatively affected by the change. LGBTQ+ patients were also more likely to be negatively affected, although this was a smaller group within the sample. It's worth a reminder that this sample is broadly representative of all patients at New Larchwood Surgery. The following 8 slides show the main headlines from the report. Half or more than half of the patients felt the following services at New Larchwood Surgery have become worse since the change in terms of 56% of patients said it was harder to book an appointment. 54% said there was a longer time between booking and seeing the doctor, and 50% said there was less choice of seeing your preferred doctor. Less than 15% of people found an improved service across the 3 categories above, as well as across a further 3 categories of waiting times on the appointment day, quality of care from the doctor or nurse, and ease of getting prescribed medication. 59% of patients booking an appointment since the change found it difficult to do so, and some patients either found it so hard they gave up or were not offered anything suitable, meaning they did not receive an appointment. Patients were asked to rate New Larchwood Surgery considering 7 different criteria. For example, being given enough time, being listened to and having their needs addressed, and the general experience of New Larchwood Surgery was positive. On average, 80% of people felt they'd had a good experience. However, when we compared experiences before and after the change in opening hours, we found that good experiences decreased after the opening hours changed by a difference of up to 10 percentage points. For example, listening to the patient and explaining tests and treatments. And also, poor experiences increased after the opening hours changed by a difference of up to 8 percentage points, for example, involving the patient in decisions about their care. In addition, 24 people mentioned the need for the nurse practitioner to be reinstated at the surgery. Comments indicated this had further negatively affected the service at New Larchwood Surgery. 59% of people were dissatisfied with the reduction in opening hours. 49% of patients said they were less satisfied with their experience at the surgery since the reduced hours, and only 5% said they were more satisfied. Most patients, 81%, stated they wanted to see New Larchwood Surgery open for longer than the current hours of 2 mornings. And it is worth noting that in the years of conducting surveys, Healthwatch has rarely seen a figure where 4 out of 5 patients are requesting the same thing. 75% of people provided negative examples, that's narrative examples of how the reduced hours had affected them. Again, it's worth noting that 3 in every 4 people were negatively affected in some way by the reduction in opening hours. For example, people found booking an appointment and or travelling to Carden surgery difficult. People also experienced negative impact on their mental health, and 16 people avoided making an appointment due to this change. When we looked at the impact of the change on patients, we found that in comparison to other groups, patients with long-term conditions and informal carers were likely to be less satisfied with the service following the change. LGBTQ+ patients and women were also likely to be less satisfied. Based on the evidence shown in this report and from the experiences of 385 patients, Healthwatch Brighton and Hove makes the following recommendations, which may be of interest to the clinical commissioning group and to the surgery. There are 3 recommendations here, and we would highlight number 1 as being the most important, followed by 2 and then 3. 1 is to revert to the original opening hours at New Larchwood Surgery, opening every day with a mixture of mornings and afternoons. And as we have shown previously, this is particularly relevant to patients who provide unpaid for care for another person, patients with long-term conditions, LGBTQ+ patients, and female patients. 2 is to reinstate the nurse practitioner at New Larchwood Surgery on at least 3 days a week with a mixture of mornings and afternoons. And 3, provide the option of online booking for New Larchwood Surgery. Cool. So that is a summary of the survey that we ran last year and of what the patients said to us. And now I'm going to pass over to Michaela of the clinical commissioning group to provide a response, after which it will be open for questions from any of the patients.
Thank you, Michelle. And before we do that, you have 2 hands up. One's from Jack and one's from Sylvia.
Thank you. Jack and Sylvia, I'll go to Jack first. If it is a question about the data that I can answer, I'm happy to take that question. If it is about the general concerns that were raised by patients, can I ask if you can leave that until after Michaela's provided her response, because she may give you some answers in there. So over to you, Jack. Was it a question about the data? You'll need to unmute. Hi, Jack. Jack, we can't hear you at the moment, so. Okay. Okay, I'll pass over to Sylvia.
Hello there. You read the recommendations, but you didn't go on to read also the CCG should consider the following: address the lower satisfaction rates among informal carers, patients with long-term conditions, and LGBTQ plus patients.
Yeah.
In comparison, sorry.
Yes, I mentioned that within the first bullet point, the first recommendation. So within the reverting to the original opening hours, it is to ensure that those needs are met, because those particular demographic groups, as you rightly point out and we've shown, felt the change harder than many others.
Fine, thank you.
So I'll move on to Michaela. Jack, if you can hear me, because we couldn't hear you, and you do have a question, you're most welcome to write it in the chat, and I will pick that up after Michaela has spoken. So I'm now going to mute myself and pass on to Michaela.
Thank you, Michelle. And I'd just like to say thank you to Healthwatch and the patients of the practice as well for taking the time and energy to make your views known. It's very helpful to hear all of your voices. So I just wanted to thank you all for that first and foremost. In terms of the three questions that's been posed to the CCG, I'm also happy to bring in the practice with Reka. I can see you there. Hi, Reka. If we talk about the first one, which is why is it not possible to increase the hours at New Larchwood? This is a question for the practice. This isn't something that the CCG particularly can influence, because the main, as you know, is with Carden, and the practice is offering the full range of services, and New Larchwood is the branch of Carden Surgery. So I just wanted to be clear that isn't in the gift of the CCG to alter, and it is in the practice. And we have spoken to the practice. We've had a great conversation with the practice, and I am really clear that the working arrangements of both the staff from both sites, when the sessions are running at New Larchwood, it does mean that there's a lone worker at New Larchwood and there's a lone worker at Carden. So a lot of this centres on patient and staff safety. So we just want to be really clear that when the services are running, it's running in the safest way possible for both the staff and patients. And this was all outlined in the original press release that went out. And I know that in terms of the press release, that we did cover this back end of last year, and we did recognise that there is a lot of learning that we've all taken on board from that particular circumstance, and that has influenced the timing, etc., of press releases as they go out for any practice changes. So that's the first point I'd just like to cover at the moment. Happy to take questions on that, or happy to also continue down the other two points at the moment and then take questions at the end. Is that okay? Okay. One of the questions was around potentially providing transport, because it's a long way between the practices. And again, this isn't something in the CCG. Practices, the practice does offer online appointments. It does offer telephone appointments. So there is an opportunity for practices to engage at Carden's, even if they can't physically get to Carden's. So I'm happy to bring the practice in a minute, and you'd be able to have a rounded conversation in terms of how you can access that service. In terms of the practice nurse, that is a recognised gap, and I do know that the practice has been working very hard to recruit to a practice nurse for New Larchwood. You won't be unsurprised to hear it's a national workforce is a national issue, and that's reflected both regionally and here locally. So we have a number of practices across Brighton and Hove that are struggling to recruit to key members of staffing, but actually across the whole system for Sussex, it's very challenging at the moment to recruit to certain posts, and practice nurses do come under that umbrella. So we know that that is a gap at the moment, and I do know that the practice are doing everything they can to recruit, but are unable to do so at the moment. So that's a reflection back at the moment. I just wonder whether it would be possible to bring in the practice for you to have the practice to hear the practice view as well.
Hello. Hi.
Hi.
Yes, I'm ready to talk.
Yeah. Hi, Dr. Shah.
Hi, I'm Dr. Shah. I've been with the Carden and New Larchwood Surgery for 35 years. So I've actually worked from the tiny little surgery, branch surgery, which is next to the chemist, to bringing it up to the present condition. We moved actually to the New Larchwood Surgery, which we've got now, for about 10 years. And we developed that. And in fact, I developed that with one of our nurse practitioners, not Angela, but a previous lady. And we built that up and set up the model for a nurse practitioner role surgery with a GP support, because she was very competent, able, and felt she could take that responsibility on. Luckily, we were followed by Angela, who was absolutely amazing professional, I think. And because of also Angela's special interest in LGBT patients, I think we attracted patients. We also supported a lot of patients with special needs, mental health. And I think Angela was very, very, very good for the surgery and for the patients of codeine. Unfortunately, Angela left us 2 years ago in January. We had advertised for a long, long time, unable to recruit a replacement nurse practitioner. The things we found was people with that level of training and expertise, people working on their own. The lone working, it was very difficult for any of the younger trained members of staff. And I think they were reluctant to work lone working. So in fact, we had to fill those sessions with GPs. We've also since then left have had loss of Marion, who was a very experienced nurse that used to come to New Larchwood. She's retired. I think since our survey, Kelly, who was the manager that helped with some of this Larchwood paperwork and the survey, has left. So we've been without a manager since September, waiting for Caroline, our new manager, to join us at the end of January. We've got a partner of 6 since August, so we're trying to double up. So it's been hard to maintain both surgeries with enough workforce. Locums are very rare at the moment, so we have been very, very stretched. I think, as we've mentioned a little while ago, COVID, with the introduction of COVID, we have adapted to our work style. We're able to offer telephone, video consultations, electronic prescribing. And in fact, we've worked really, really closely with the local chemist and Larchwood itself to try and adapt as many ways of working and trying to fit patients where we can, even if it means telephone initially and then either a visit or slotting them into the next available surgery. So we've used every possible way of trying to manage patients in the most efficient way. I think online, I think people did mention, we've also got facilities on the website, which patients can put e-queries. They can also request medication on the website. There's also the prescribing pod, which answers calls from the city for prescription requests. So we have had various innovative, I think, ways of working to manage not only Larchwood, I think all Carden, and with COVID working, I think, to try and keep the patient care going. I hope that sort of answers some of the questions. Some other things which we have done is all Larchwood appointments are reserved for BN19 patients. So any other patient that is not a BN19 patient cannot book into those slots. We've done extra flu clinics out of those 2 sessions to cater for the codeine population. I think there was a disease management clinic, which was again extra. One of the nurses from Carden came and did that for patients that couldn't travel across to Carden. And we're still looking at other ways of trying to individualize the care. I think, I don't know how well you all know the Larchwood background, but when this surgery was reopened, we started with a list size of about 100 or 200 patients with a full complement of staff. As the surgery grew, obviously the demand was more and the capacity changed. Now, having to adapt with Carden as well, people are struggling with the lack of that personalized care that we did give. We could offer an appointment anytime, any session, any clinician. We're not always now able to do that. But I think with all the new ways of working, we're still hitting the targets of 2-day prescriptions, seeing as many patients as we can, offering appointments, online appointments, and other ways of consultations. That's in summary. I think obviously we're still willing to listen. We're still thinking we're hoping to recruit a phlebotomist in the next couple of weeks, which will ease the pressure on our nurses to try and possibly think about nurse sessions at New Larchwood as well. But at the moment, we are struggling with workforce, I'm sorry. But we're still willing to listen to any other ways of working. Thank you.
Thank you, Dr. Shah. I have some comments on that, but first of all, I want to hand over to patients. Are there any patients who would like to ask a question of either the surgery or the clinical commissioning group? I can't see any electronic hands up.
You have Jay. Jay's got his actual hand.
Yeah. So JD, would you like to ask a question?
Thank you. I don't have any questions about the data. It's very, very interesting. I'm interested to hear from Dr. Shah about the services which are available, because it's been difficult to find out what is available at New Larchwood. I don't know where you find that information. I don't mean that as a criticism. I mean that as a positive, to say getting information out to the residents of Coldine, BN19, there's nothing positive come out. So it's a matter of bearing in mind the age of the community and the disabled people we have in this community. There needs to be a positive action as opposed to just sit and wait for something to happen. I don't know how you do that. I just throw that in the pot. The second thing is, I understand completely about lone working. I know that in the NHS, having worked in it for 10 years, there are volunteer programs. You get searched out, obviously, for your history and police reports and et cetera, et cetera, et cetera. I'm fully retired. I'm one of those who is still quite physically able, but think to the future that if I can't drive anymore, then I'm going to have problems getting to, if I can't drive, then I'm going to have the same physical problems that I can't get to Carden Avenue. So although it doesn't affect me now, it may well in the future. But aside from that, I do have time, not full time, but I do have times I could do the odd morning, the odd afternoon to be a volunteer. And I feel quite certain there must be others who are willing to join a group of volunteers who, working with the receptionist, we could develop some sort of regular pattern, even if it's a small regular pattern. You know, somebody do Monday morning, somebody do Monday afternoon, somebody do Tuesday morning, somebody do Wednesday afternoon, something like that. If we could get some groups together, I'm quite happy to throw my hat in the ring, because having worked with my wife, who some of you might know is now departed, unfortunately, because of cancer, we used to work at New Larchwood at the home there, helping the residents to keep mobility going. And one of the biggest problems with so many of them having major disabilities, getting a bus to Carden Avenue, are you kidding me? These people can hardly get out the building. You know, so if for no other reason, it does need to be there. And within the recommendations, it certainly needs to be an all-day Monday and then Tuesday, Wednesday, Thursday, Friday afternoon from a GP's point of view. I couldn't cover all of those, but I could certainly help with some of them. I don't know whether there'll be others who would be willing to throw their hat into the ring, but you can put my name down. Thank you.
Thank you, JD. I think that's a fantastic offer that you've made there. And I think that if there were other patients who were willing to do that, that may be a way to ensure that the whole lone working situation is answered. Right, I've made a note of that as well to put in the write-up of the meeting. Rose, I could see your electronic hand up, so I'll pass on to Rose. And then there is also some other questions in chat, but I'll get to those.
Hello, this is not from me, it's from someone who's contacted me who can't be here because she's working. And she said a lot of stuff, some of which is most of the general stuff that has already come up, you know, problems with the getting there by bus and everything like that, and how much we need a nurse practitioner. At one point she's made, her son is on immunosuppressants following liver transplant and cancer. He has to get the bus to the surgery for regular blood tests, and this puts him at risk when we used to be able to walk to New Larchwood. And I just wondered, Dr. Shah, would having a phlebotomist, is that going to actually make this kind of thing easier for people who are actually going to be at risk by travelling by bus? Would it be guaranteed, if there was a phlebotomist, that he or she would be able to spend time at New Larchwood and be able to see patients who need blood tests?
That's correct. In fact, most of us GPs are doing blood tests there, dare I say it. I don't know if it's best use of our time, but we are doing the most essential blood tests at New Larchwood.
I'm assuming that this person must need it more often than once or twice a week then, because she said he's got no choice but to travel. I can put that to her, that the GPs are doing blood tests. I know, I mean, I've had a blood test from Dr. Mervyn Thomas recently. So
both of us do it anyway at New Larchwood. That's right. And we've always been aware of that, but hopefully if we get the phlebotomist recruited, phlebotomy is one of the big things. I think it would be good to get a local service, I think, and it's one of the most needed for patients. Makes a difference. Really.
I think it would. I'll pass that back to her. Thanks, Dr. Shah.
Just on that point, can I clarify that if when you're looking at a phlebotomist, are you looking at them being there on every day, or will that be, you know, once or twice a week? Because if the question that Rose's patient has asked, it sounds like it may need a daily. So is that something you're looking at?
What we'll have to do is see what we get, dare I say. It's more from human resources, what people can offer us, how many sessions they can offer us when we're recruiting. Okay. We're tied by that rather than, because a lot of these girls are also, or people are also vaccinating for COVID at the moment as well. So if they have capacity, they're going to give us sessions for phlebotomy. So people are really being stretched in every way at the moment. A couple of other things I was going to talk about. Yeah, I think
just to finish on that exact point. I guess what I was trying to get at was, do you have the budget for a phlebotomist every day? I know that there are capacity issues on the other side and getting somebody appropriate, etc. But is there actually the budget within the GP surgery to provide that service on a daily basis?
We would be stretched, but I think phlebotomist we would try and cater for, I think. And the other couple of things I was going to mention was, somebody did put in website details on the chat line about all these services that are available at the surgery. And I think if needed be, we could by all means do a leaflet or a letter that could go with the residents' newsletter, informing them of all the practicalities of obtaining stuff at the surgery.
Okay, that's a really good point to make as well. So information with the the residents' newsletter. That's great. Are there any other questions from patients? From anybody else? Sylvia, I can see your hand waving.
Yeah, sorry. There seems to be a heavy dependence on new technology. Now, I'm not sure that everybody has access to new technology. It's extremely expensive to plug into broadband. Older people who haven't worked with new technology don't have anything to do with it. And I'm just worried that there's a lot of stress put on new technology. Well, we can do this, we can do that. And I think there's going to be a tranche of people who are actually being excluded from that.
Just to respond to that, although I will ask the surgery or the CCG to respond officially to it, from our own research at Healthwatch, I would concur with that. There is most definitely a group of people who will be excluded and are absolutely excluded by the reliance of technology. I would also say that from our very recent research during the pandemic, where of course many of us were reliant on online because of that particular situation, it did exclude a number of people, not just through age and demographics, but also there were certain conditions, certain illnesses, certain procedures that needed to be done that could not be done online or over video. So referring back to what Dr. Shah was saying, and I can understand you're doing your absolute best to offer as many things around what is available at the moment. While we all understand the COVID situation is difficult, once we are clearly out of that situation, I think patients would expect to go back to much more face-to-face, and therefore the 2 mornings a week would actually be of significance, of much more significance. So I'll hand over to the Dr. Shah, if you'd like to respond to Sylvia on that technological point.
I understand, and I think throughout the last 2 years, our doors have always been open for walk-in queries or face-to-face people. So yes, we've been fully aware that not everybody has had the savviness or even the availability of technology, but I'm afraid we've been led that way by all the powers of be as well, to go along those ways to provide services through COVID. But we're happy with that. Yes, we're happy to open our doors again as soon as all the restrictions ease. And I think not only us, I know Bijesh, the pharmacist, has always been willing to receive calls and then filter them through for us, or offer minor ailments or minor advice as well. So I think Codeine, we've all worked together well. I think not only now, but over the years we've managed beforehand as well.
Thank you.
Right, I just wish to see if there is anybody else who's got their hand up. I can just see your name is EMS. So please go ahead and ask your question. Welcome.
Hi, thank you. Yes, it's Emma. I think Deborah may have asked this question as well, and I'm aware and I understand that there's a problem with supply of doctors, nurses, phlebotomists, that kind of thing, but also it's a concern that they are building new houses in the other side of Coldine, and that's going to put even more load on a surgery, and we really need another doctor, another nurse, and it really needs to be addressed. But I don't know how in the short term or the long term whether that is going to be achieved, and it's a huge concern.
Would either Michaela or Dr. Shah like to respond to that?
I'm happy to pick that one up. Is that okay? So in terms of the redevelopment and the buildings that are going on all over the place, but particularly around your area, we are aware that there are redevelopments taking place at the moment. However, workforce is a national problem at the moment. There are a number of different avenues that both nationally and locally we are going down to try and plug the workforce gap, which will term solution, but longer term it is around how do we grow the workforce in effect. How do we make sure that we've got more of all of the different types of clinicians that we've already described? How do we get them coming through where we can start to employ them, and we can, I say we as the system, so CCGs don't employ people, but we can support our practices to recruit to these different posts. So I think we just have to be brutally honest at the moment and say we know it's a problem. It's on our radar. We do recognise it is a short-term issue. However, we are working with all of our practices around how we can plug some of these gaps medium and longer term.
Thanks. I would like to just pick up that point by Michaela and also that Dr. Shah has made. And I think we all understand that there is a pressure on workforce and capacity issues. But I think also, if we listen to what the patients are saying, why, when the Carden is clearly able to not only offer a service, but offer a service with longer hours, why there isn't the possibility of sharing the longer hours, reducing the hours slightly at Carden and putting that staff back into New Larchwood. And I think we've already discussed the lone working situation, and it seems like you have at least one patient. I'm fairly sure you will get some more because these patients in front of you are just fantastic in their concern for their own local neighbourhood. I am sure you would get 2 or 3 patients who would be willing to help out with that lone working situation. I can see nodding heads and thumbs up. So while we understand, just to make clear that I think we understand bringing anybody new in is difficult, could, as the patients are saying to you, could you not consider spreading the GP and nurse who are currently at Carden and making them more available at New Larchwood? Because it's still not addressing what all of these patients are saying to you very, very clearly, that we need a GP and nurse more regularly at New Larchwood. You have a number of people, it's shown in the survey, the patients are clearly saying that they find it difficult to get themselves to Carden for various different reasons. Mobility, age, illness, and mental health are all making it preclusive to get over to Carden. So if there are GPs and nurses available at Carden, can they not be put over to New Larchwood? And I wonder if either Michaela or Dr. Shah wishes to pick up on that.
I think it's something we're going to have to consider and review. And I suppose the one point I was going to say about the new housing coming in our experience, initially, patients often, if they're coming from Brighton and Hove, will come with their own GPs. So I think we won't all be inundated initially, and then patients, as they get established in the local area, get to know the local services, will slowly filter to the local surgeries and sites, I think. And if they do go over up to County Oak, there's Warmdean as well as us. So depends which direction of travel the new block of flats that are developing patients go to. And I think the other pressures we are feeling as a surgery also is going down the Lewis Road. I think the capacity with the Avenue surgery, the Lewis Road surgeries, Park Crescent, they've all reduced. So we're constantly also getting a filter from other surgeries as well. So with the Bevendine site now not open either, I think we are probably one of the few sites in that area. So I think we ourselves, once our human resources settle down and once we sort out our internal issues and our manager is back in force again, I think we can review our hours or people power, I think, really.
Thank you, Dr. Shah. Just to come back on those points, and with all due respect, this was supposed to be the review. In fact, when we had the meeting originally with the Residents Association back on the 28th of May, this situation was supposed to be reviewed within a few months. And that was part of the reason why we did the patient survey, to find out actually whether it was just the Residents Association and a few patients who were making this point, or whether it really was the majority of patients. And as we've clearly shown, the sample that responded to the survey are very clearly representative of all the patients at New Larchwood, and they are saying to you that we are not happy currently with the situation. And I do also take on the point about the new housing, which is only going to increase that pressure. I think, although your answer to that was we don't know where those patients will go, I think if we just look at the current situation and the current patients you have at the moment in New Larchwood, they are unhappy and they are saying there isn't enough of the service. And I really think, as a surgery and also as a CCG, which ultimately, while it is the surgery's decision around opening hours, they are backed up and funded by the CCG. It is both your responsibilities to listen to what your patients are saying and to respond to your patients. And what I am hearing, and I'm not sure whether everybody else is hearing the same, I am hearing, well, it will be reviewed. Well, this is the case. Well, unfortunately, we can't. Well, we're doing this with COVID. But actually, you're not responding clearly as your duty is to your patients. And this is not Healthwatch's opinion. This is what the patients are saying. This is what 385 people have said. And both of you you haven't given, as far as I can see, a clear answer to what actually is going to be done to increase the service at New Larchwood. You've got a set of patients willing to sort out the lone working. You have increased the hours at Carden, so therefore you do have the capacity to put into New Larchwood, and you obviously have a nurse at Carden, so that nurse could be shared a bit more evenly, at least once a day or 2 days a week at New Larchwood. What is actually going to be done? And I think none of the patients will be willing to leave this meeting until we actually see something on the table that is being offered in response to what patients have asked of you. Deathly silence.
It's very difficult to give you a definitive answer, because I think we all have to appreciate the immense amount of pressure everybody has been under for the last 2 years, but particularly practices who have gone over and above all requests to provide a service to patients whilst we're in a national pandemic, whilst we're dealing with the vaccination programme, and whilst, to be fair to practices, are dealing with workforce issues as in that we've already described, but also the fact that practice staff contract COVID, have gone on and off with COVID, and the practice has gone over and above trying to keep the doors open for everybody. And we recognise both patients and practice staff have really suffered in the last 2 years through the national pandemic, and that we just need to be honest with that one. I think in terms of our branch surgeries, we have had a number of branch surgeries across Sussex, but Brighton and Hove as well, closed and are still closed. So we are very fortunate to have a branch surgery available to us. We did come together, exactly as you say, Michelle, thank you for facilitating that, where we were able to hear from Carden residents, from the Colding Residents Association, and we were then we then knew that we had a PPG that was going to be further developed as we went on. I think we have addressed some of the issues around access. So in terms of the practice providing a good range of services, we know that the overall practice does provide a good range of services, and the CCG are happy with the practice in that respect. I think from the comments that we've picked up and through the survey, and as I said, we do thank the 385 members of public and patients that have taken the time and effort to put forward your comments and opinions. It's really well received, and we thank you for that. As I've said before, I think it's very difficult when there's a request or trying to describe and explain how funding works across the healthcare system. So the practice is funded by isn't funded by the for access. We don't fund that. The contract is sat with NHS England, and we have no problem with the surgery, as we've said before. The increase in hours for the branch surgery, we described we are struggling with workforce, particularly in light of the practice nurse. We know that the practice nurse was very well liked, ran a very, very good specialist service, and we know since that person has left, the patients that used to engage with that particular practice nurse have suffered as a result, and we acknowledge that, but we also acknowledge that the practice is doing everything they can to a new person to come into that post. Before, there's a national issue with workforce, and therefore that's reflected both regionally and locally, and it's not unusual for practices to really struggle at the moment to recruit to clinical staff. So it's it's really trying to be fair to everybody around describing the current situation. We've heard what you've said, and we're very, very happy to work with you on making some of the changes. Some we can't, as a CCG, we can't influence the practice in terms of hours to open on the branch surgery, and it's really encouraging to hear that there are some fantastic people with skills that would, I'm sure, be very well received, both at the practice, but I should imagine in the voluntary sector as well, around how you can improve some of the things that are going on at the moment. And particularly, we hear about befriending services and other services that the voluntary sector offer. That might be something that would be useful to maybe progress at a different time. But in terms of the volunteers helping at the practice, that's absolutely between the and the practice. And I do know that there are a few issues that we would have to overcome in terms of patient confidentiality, etc., if that was to take place. But absolutely welcome any engagement in that way. So I just wanted to be honest with you. I don't see there's any reason in being anything other, but just to describe to you the current issues that we've all been facing over the last couple of years, and the way that we have attempted to move this forward in the current climate. Of course, as we come out of the pandemic and the situation settles down a little bit, who knows what's happening with the workforce as it starts to move about again. And that would be the time when we can start to consolidate some of the things that we've got and look to continue to recruit. But as I said, the recruitment does sit in the gift of the practice. Jay,
you have your hand up.
It's just one final thing. I think we would like to have some sort of confirmation that there's no behind the scenes intention to close the surgery altogether, and that there is or there will be, or they're in the process of developing a plan to how to expand the services at the surgery, rather than just, I'm not saying you're doing this, but I wouldn't want people to feel that they're listening, that we can't do anything about it now and it's left there. I'd like to know that it's an ongoing dialogue between the commissioners and the surgery, that there is a positive intention to reopen services or expand services as soon as practicable. And I think at least that will give us some comfort that there's no behind the scenes intention to shut the service down.
From CCG, I can absolutely categorically say there's no behind the scenes intention to close the surgery down. Absolutely not. And we are very much, as I've already described, very keen to support all of our surgeries, but your surgery, your surgery as we're talking about it here, very happy to come together in another 6 months if that's something that would be helpful to you, particularly as we start to come out of the pandemic, looking at potentially re-energizing the patient participation group, the PPG that I know we talked about before, and whether that's something willing participants would be happy to engage with. I'm looking at Raquel in terms of how you and your staff would want to take that forward, and I'm sure our development managers at the CCG would be happy to help you support you in that. But I think that's something that should be welcomed, because the patient voice is very strong and indeed really welcomed in all of the developments, and that way you will be able to hear firsthand the intentions, of which there isn't any intentions of making any changes at the current time.
Okay, I think that's great, Michaela. Thank you for assuring the patients that the surgery is not going to close down. I think the offer of coming back in 6 months is a little bit on the long side. After all, we're coming out of this pandemic, you know, potentially in a month's time, we're going to be looking at less restrictions. We're already looking at less restrictions than Christmas time. So while the pandemic is probably, COVID itself is not going to be going away, I really think if we're looking at 6 months, that's a year from the time when the opening hours originally decreased. And I think that will be a bit lengthy, to be honest. I do hear the reasonable intention that you and I can hear from Dr. Shah the intention that you are reviewing, that you are trying to do your best for the patients. I'm not necessarily hearing anything completely concrete. I haven't yet heard those golden words. We most definitely are intending on increasing the opening hours, or we most definitely are intending on getting a nurse. I can hear that you're doing your best to recruit a nurse. However, I also hear that you haven't had a nurse for 2 years. So I'm just wondering what happened in those 2 years. So that doesn't sound as concrete as I think patients would like. So my concerns are that if we end this meeting, that patients are going to go away and think, well, they have heard us, we have made our points clear, they're saying they've heard us, but actually, as far as anything specific on the table, there doesn't seem to be anything. So I suppose as a sort of another chance, is there anything that Dr. Shah or Michaela would like to add to that?
I think I've said as much as I can. I cannot promise anything concrete today. We have tried the recruitment as much as I can. I'm hoping our new manager, when she's in post, can push again to try and recruit and rejig some of the workforce to provide some extra service at Larchwood. But I cannot promise anything at this point. I've got to go back to the practice, discuss it all again with the rest of the team, and then come back to you.
Michaela, would you like to add anything to that?
No, just to reaffirm that we're working together. We're all working together on the service that we've got currently. Very happy to come back together. I just wonder if it's any sooner than 6 months, what we can potentially achieve in that period of time. I mean, I'm very happy to take comments and for people to contact me after if that's helpful. But I would welcome to come back together, have a further conversation in terms of what we're able to do, and have a situation update.
Okay, and to both of you, but particularly Dr. Shah, the comment that was made with regard to not necessarily about recruitment, as we can hear that you're certainly doing something in that area, but in the ability of sharing the current service at Carden a little bit more with New Larchwood, i.e. having your GPs and nurses at Carden do slightly less hours so that they can put maybe another morning or another 2 mornings or perhaps an afternoon into New Larchwood. What response do you have for that idea? And obviously with the backing up of patients being there to ensure there is no lone working.
I can take it back to my team and my partners, and as I say, we can come back to you and or the CCG and negotiate this further.
Okay. So is there anything any other patient would like to say? And also, I'd like to hear from Rose the best way that we can communicate, or the surgery can communicate with the patients about any further developments on this particular issue?
Yes, well, the next newsletter actually, and I did type a little message to you, Dr. Shah, and we can email about it. The deadline for the next newsletter is actually the 26th of February, which isn't very far away, for distribution in March before Easter. If it's possible to get a leaflet or anything with something reassuring, again, just saying, I mean, I do understand how difficult it is for you with the reduced staff and everything, but even just saying, look, we're going to get a phlebotomist, we are going to work towards having more hours. I think that will just make a huge difference in people's feelings that we are being heard, and that it's not just, well, look, this has happened and there's nothing we can do about it, and no matter how loud you shout, it's not going to change. I think that would actually be great, because that newsletter goes to every single Coldine, and obviously not everyone in Coldine is a New Larchwood patient, but it would definitely get to them all. So that would be a great thing. I do have a email list of about 100 Coldine residents, which is sort of gradually increases bit by bit as people get to hear of it. Again, obviously, I have no idea how many people on that list are New Larchwood patients, and it's not the whole, but anything that the surgery or the from counsellors or anything, I say, oh, could you send this to your list? I always do send it round. And we also have very good Facebook pages, don't we, guys? We have Coldine Social and we have Coldine Village Chat, and stuff gets around really quick on those. So the newsletter, the email list, and the Facebook pages, I would say, would be the three main ways that information would get out there. And Anna, would you agree, and everyone else agree?
Yeah.
That's brilliant. And also, obviously, the surgery put out this meeting via text. So perhaps it might be an idea to put a text out to the patients to say that there is this newsletter with an update on the hours, or put something on your website to assure patients of what you're doing. That would also be useful. And if the text refers to both the newsletter and to the website, to the surgery website, then I think that would certainly help. And if they have access that way to the newsletter, then it means that they could get Rose's contact details from there as well, and to be added to the newsletter distribution. I saw Lucy's hand up, so I'll ask her first, and then Jay after that.
Hi there. I only wanted to flag that there's comments in the chat that haven't been kind of taken up and spoken about. I made a couple of comments because I'm working while I'm on this call, so I couldn't stop to speak. So I just wanted to flag that. Thanks.
Thank you. I did look through them. They seem to refer particularly to the additional residents through the housing, the increased housing, which I think we have certainly covered, and that is definitely going to remain a concern. There is also the reliance. There's somebody has made a point about the reliance on online, and we also covered that as well. I do think that the surgery in particular need to think about those patients who don't have access to online, who are unable to use that technology, even while we're in COVID.
None of my comments related to those things.
If you want to say your comments.
Well, sure. I suppose my comment really was a bit more transparency. I said that was the bottom line, that there would be no change to the opening hours, because, and if so, is that only dependent on recruiting a nurse practitioner? Like, if you could recruit a suitable practitioner, would this then change, or is it a permanent decision? If you can, is there any plans to potentially recruit further GP cover? I mean, I'm not entirely sure what the reason for reducing it was in the first place. Obviously, it was pre-COVID, so I completely appreciate the stress and strain of COVID and the vaccination program. That goes without saying. But this, I think, predated that. I don't think the hours were reduced because of COVID. So kind of COVID aside, will they go back up? Are they actively looking to recruit GPs? I know they've struggled to recruit the nurse practitioner, but if that changes, is that a guarantee that the nurse practitioner would be based there? Like, just a bit more kind of, I don't know, transparency or clarity on that. And also just to add, and I'm sure this came through in the responses you had in the surveys, which I appreciate is partly COVID related. This is a change that has come into place because of COVID, which I understand, about the online or phone appointments. They seem to offer this another layer of red tape or admin, which can be really off-putting for many people. And it feels like a waste of resource, actually, like a waste of admin resource for everyone involved to set up phone appointments, which then ultimately end up needing a face-to-face appointment after that. And it can, especially for people who are working, being available for that phone call back, you know, it's not actually very accessible for a lot of people. And I think that might lead to some people just not bothering attempting it. Yeah, I'm sure that came through in your survey anyway. I'm sure people raised those points. And lastly, just to say that it is quite difficult to wait all this time, you know, for so many patients to give their time and give their responses, and then hear this, you know, be in a meeting with the CCG representatives who obviously say they've got no ability to affect change on those issues. That's just quite a difficult pill to swallow, if you'll excuse the pun. And again, I suppose is the bottom line that GPs, it's within their right to withdraw or reduce a service without any kind of, I don't know, accountability from anywhere else. Is that just their choice because essentially they're a private business in that regard? That was it. They were my comments. Thanks.
Thank you for that, Lucy. That was a brilliant sum up. I think with all of these, I think with the more transparency and the increase of hours, and is there any dependence? Is that only dependent on recruiting a nurse practitioner? And is there any plans to recruit new GPs? I think Dr. Shah, could you answer that one? Dr. Shah? Is there frozen, maybe?
Yes, I think, if I'm not mistaken, I think somebody asked about the contractual requirements. As New Larchwood does come under a branch surgery, and we had a lot of meetings and debates about this with the CCG when the reduction in hours were being negotiated. They seemed to say, because it was a branch surgery, hours could be changed without public consultation. But if Michelle can, I can be corrected on that. At the moment, there are no plans on a further reduction. Providing we can get the workforce up and running again, we can try and increase our services, especially as we've all highlighted. I think the new population which will come in with the new block of housing that's going to be redeveloped, I think it will stretch the existing services at New Larchwood for us as well. And I think GP recruitment might be the case.
Okay, so just to clarify, I think Lucy's question was, is there are you looking at recruiting a new GP? And is there a possibility that you will increase the hours if you get more, if you're able to recruit, for instance, a nurse practitioner, or increase the capacity at New Larchwood? And I think your answer to that is yes, by the sounds of it, that you are certainly trying to recruit a nurse practitioner, and you will look to recruit a further GP as well. So that is really positive. That needs to be put in the newsletter, and that needs to be put on your website as well, to make it absolutely clear to all patients. Her second question was around online and phone appointments, and I can agree from other patients at other surgeries that have gone and used the online booking system that it tends to send you around and around in a circle, where you get various people phoning you back, and then finally you get to see your doctor. So it does indeed do what Lucy has said in our experience anyway, which is add just yet another layer and further red tape. I'm not sure if I'm sure Dr. Shah can respond to this, clarify this for us, but I'm not sure whether that works with the bookings, the online booking system on your website. Is it more specific or more direct than that? Does it go to the GPs there?
Well, there's a couple of ways of doing it. One is you can log in a query on the website, or you can book online onto the appointment system itself, or you get a telephone call consultation with the GP or the nurse, and then they will ring you. And I'm afraid I was quite skeptical about telephone consultations, but in my experience, since last March, I haven't done true survey yet, but I'm planning to do this. And in my opinion, a lot of patients are happy. They've not had to travel. They haven't had to take time off work. And actually, so many problems we have been able to deal with on the telephone. But obviously, I haven't got statistics to show that. But I have been amazed at how efficient some of these services have become because of this different way of working. But you know, I'm open to suggestions by other people, and some people have preferred that rather than taking time off work. So it's horses for courses, I think.
Okay. I think what I'd certainly appreciate, and probably Rose would as well, to add into the newsletter, is because you've given 3 examples. You can log in a query on the website, you can book an appointment online, you can book a telephone appointment and be called back. And if after this meeting you can email me with just how you do that, like a step-by-step, is it just a button you press on the website or something, and that can be included in the newsletter and also be included in our information that we write up after this meeting. The third thing is, yes, well, I have to agree with Lucy's point, because that's kind of what I was saying earlier. On behalf of patients, which is that so much time has passed since the opening hours have reduced, and it is difficult to hear the CCG say that they, you know, can't do anything, they don't have any influence over it, when we're all aware of how the funding works, but actually we're also aware of part of that funding can be offered to surgeries to help out, as it was done in the time period prior to the opening hours being reduced. So I am very aware, as are patients, that the CCG do have more influence than you know, it just being passed off to the surgery on increasing opening hours and offering additional funding to ensure that there's additional capacity there.
Can I just ask
a
point of clarification on that, and just ask for an example of what that means?
Well, prior to the opening hours, there was an agreement, wasn't there, between the CCG and surgery to help out the surgery in the time that they took over New Larchwood as a branch surgery. And that period came to an end, and therefore the surgery were in the position that they had to feel that they therefore had to reduce the opening hours because they didn't have the capacity. So that's the example I mean.
Thank you, Michelle.
Okay, and the fourth point that Lucy made, which I've very badly written down here, Lucy, is something about partners, and I'm sure that wasn't the point you made, Lucy.
I don't think I said anything about partners. I think it was those 3 things which you've covered.
Brilliant.
Thanks.
Okay, that's fantastic. As long as I've clarified and got responses on those. So I think unless anyone else has anything they would like to add, what I personally would like to see, as Healthwatch, we will obviously publish the report on the survey. We will put a recording of this meeting on our website, and I can make that available to the Residents Association, so you can ensure that it's shared with all the patients who were not able to turn up today. And but I would like to see from the surgery the things that we've talked about already, which is you link in with the Residents Association. You put a text out to all patients to ensure that they have a reference to the newsletter and to their own website, on which I would expect to have some updated information on what can be offered and what is being done to resolve and to answer these very important questions that the patients are asking. from my point of view, I think the patients have been really open and honest with you about what they want and also the reasons for it. They have made the point that it isn't, they're just not saying, oh, well, it's fine, you know, okay, so I just wish they were more opening hours. They've given clear reasons, mobility reasons, illness, mental health conditions that are being negatively affected by this change. And I think the surgery and the CCG within that partnership really do need to respond to the patients in this respect. So I am hoping there will be some information on websites and through the newsletter. I will also, on behalf of the patients, follow up the offer by the CCG to have another meeting to review where we are to date on I would suggest maybe 2 to 3 months, but I want to speak to the Residents Association about that first. I can see Rose nodding, so I think I've got about the right.
2 to 3 months sounds good.
2 to 3 months, because I think if it slips to 6 months, I just think it will get pushed under the carpet, as it were. And that's not a criticism to the CCG or to the surgery. We can all hear that there are good reasons. We can all hear that there are things that are being done, but I feel they're not being communicated well enough with patients. And I feel that the patients are still saying that obviously there are things that could be done. I would also ask that those patients who have very nicely suggested they might support a lone working situation to get in touch with Rose, please. And we can make sure that, or she can make sure, I'm sure on her own, but with my support to make sure the surgery are aware of those patients so that that service could be looked at being helped. Again, I wish to say there isn't a criticism on any one particular person here. I don't think any of the patients are criticising, but what they are saying is we would like our service run a bit more effectively because actually we're not getting the help and support that we need. So thank you so much to everybody who has turned up. I also wish to thank all of the patients who responded to the survey in the first place, because they were very honest about their opinions and about the situation and experience. And I thank the CCG and the surgery and the Residents Association for supporting this meeting as well. Thank you.
Thank you so much, Michelle, for organising this. We really, really appreciate that. Thank you very much. This has been good.
Thank you. Thank you. Lester, you didn't have, did you have your hand up or were you clapping?
I was actually clapping. I was just echoing the thanks, and I'll put something in the chat for you saying how excellently chaired it was, and the presentation was brilliant. So thank you, Michelle. Brilliant.
Thank you. Thanks very much.
Thank you, Michelle.
I couldn't have done it without all of the patients, though. I mean, you know, we're not here to make our own opinions. At the end of the day, this is what patients have said, and we're only conveying what you are experiencing. That is what Healthwatch does. So thank you very much.
Sylvia, I would like to say something.
Go on, Sylvia.
I think you've done brilliantly. Thank you very much. Very easy, straightforward. The other recommendations I'd like to write to you about, if that's okay.
Yes, to me?
Yes.
Yeah,
okay.
of course.
I'll put your email. I'll put them in the letter. But brilliant. Thank you very much for a brilliant meeting. Thank you.
Thank you.
Thank you, Michelle.
Okay, I'm going to close the meeting now. And thank you, everybody.
Thank you. Yeah, thank you.
Bye.
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 Bye.